So we're honored today to hear from two exceptional leaders in the field to get us started, Dr. Victor Dzau and Dr. Howard Koh. Dr. Dzau is the new president of the Institute of Medicine. I guess new, lasts for a while yet, inaugurated this summer. He has a very distinguished biography and background. You have the details in your materials. He's recently of Duke University, a substantial leader in academic medicine, has a substantial research career, as well as numerous awards and distinctions. So I hope you will review that. So without further ado, I'll invite Dr. Dzau to the microphone for his comments, and then I'll introduce Dr. Koh after you make your comments. Welcome.
Good morning. Good morning and welcome. You saw that we had a welcoming party for you as you come in, right? But you know, I'm so glad to be here. And I'm glad because I get a chance to meet all of you and acknowledge the great work that you do and learn a lot more about your passion and your commitment to this field. I'm also feel extremely happy and honored that, in fact, I share the podium with Howard Koh, my good friend. Howard and I go back a long way, and I have great respect for what he's done for this country, for public health, and of course for Harvard, where he is right now. You know, I know this is 10 years, and I think there's every reason for you to celebrate. And one reason that brings us all together is our care to make a difference to our patients, to our family, and really to health and to our society. And so I thought what I'd like to do is just tell you a few words about my first 100 days and who I am, and then have a chance also speak a little bit more about the field that you're working in. So I'm a physician. For many years, I've been closely involved with patient care. I also did a lot of research, so I'm a physician scientist. And over the years, I have been more interested and increasingly interested, of course, in leadership, policy, and other areas. I chaired Department of Medicine at the Brigham and Women's Hospital and previously at Stanford. But my last 10 years have been very transformational for me. As the chancellor at Duke, responsible for health systems, and the CEO, really in the community of great health disparities and a big socioeconomic divide, it's very clear to me that the thing we need to do is really to work with the community and to address many of the issues that plagues their day-to-day activities that influence their health. So I've said to many people how important it is to, in fact, address the social aspects, what we call social determinants of health, and how important it is to really work with the people versus, in fact, thinking about principally as a place for acute care, et cetera. And that's been very helpful to me in so many different ways. And so engagement of patients, engagement of the community leaders, engagement of all the stakeholders is principally what we must do in order to improve health of our patients. This is why I think your work is so important, because at the end of the day, I know why you're here. You care about the people you work with. You want to make sure that whatever we do in health care or health prevention, that in fact people are able to take advantage of all, maximize the kind of opportunities that's available to them. So, we've made many advances in fields of medicine, health promotion, social policy I talked about, but much of that process is lost if individuals, neighbors, relatives, and leaders don't adequately understand the information they need to make healthy choices for themselves or their family. I'm told that, in fact, the cost of lack of health literacy is over $100 billion a year. That's an astounding number. And, and because what you do is trying to address this issue and trying to make a difference, and that you've made enormous progress the last 10 years. Now, so we have also learned from your work that we should not just put pressure on individuals to learn more, but we need to align health systems. You know, whether it is a healthcare delivery system or health systems in the country, the demands of complexity match it with individual skills and their abilities. So we need to make sure we respect people's skills, abilities, and values so they can actually maximize the learning they can have, understanding the choice they need to make, understanding, in fact, they are very much responsible, if not in control of their own health, working alongside with all of us. Now, I've seen many changes that's come along what you've done, and there's some list here: better food and drug labels, health professionals are exploring creative ways of communicating with patients, academic centers are increasing their focus on health literacy while training health professionals. I certainly know that when I was at Duke, that is a big emphasis we place on our health professionals. Research is illuminating the nature of relationship between health literacy and health outcomes, a very, very important issue. And new ways of measuring and assessing health literacy in patients are being developed. For example, this is a really interesting one for me. Eye tracking technology is being used to understand whether a patient's processing the health information. So I feel very blessed that I'm at IOM. And when I talk to many of you, Ruth, many others, and recognizing that we played a small role, but a facilitator role for many of you who really care about this, and you're the driver of these changes, we are happy to be able to help. So this roundtable has done much through your initiative, your effort to advance the field. It has done a lot of work to provide guidance, to help people navigate the Affordable Care Act and also health insurance policy. It's, believe me, it is pretty complicated, and has held workshops and published many papers to facilitate these conversations. I even heard that before my time, Roger Williams, who's the head of U.S. Pharmacopoeia, was convinced during one of these workshops that they need to have more patient-friendly prescription containing labels, and went back and released, I believe, the first universal standard to guide the appearance of these labels. That's impact. You know, it's what you talk about, what you take home, and you try to push people and lead people to do the right things. And that's what we're here for too. I was talking to Howard earlier that, you know, we do a lot of reports which are very impactful, but it's what happens afterwards. And a roundtable that came out from your initial report 10 years ago, and the continual perpetuation of this work, I told Howard I'd like to think of us as an incubator. Great ideas, great initiative, more place for people to think about good ideas and then move it to implementation outside of IOM. So, you know, while we're celebrating 10 years, you still have a lot of work to do. You know that, and I know that. And so I know that the Health Literacy Roundtable will continue to contribute to the great work, and we're here for you and to work with you. And I believe that you're going to talk about your next 10 years. And I think, George, your next 10 years can be brilliant with all the great work of people doing here. So thank you for welcoming me.
Thank you.